Hello, this is the first of 4 micro-learning presentations prepared for the Spur Change Capacity Building and Knowledge Sharing for Small and Medium Organizations program. The goal of these micro-learning presentations are to assist small and medium organizations to plan for and collect baseline data for GAC-funded projects. This first micro-learning session will focus on what small and medium organizations need to consider as they start planning for baseline data collection. The purpose of this micro-learning session is to help you examine the building blocks that will hold up your baseline data collection. To do this, I will cover the importance of reviewing your baseline planning to be sure that it is gender sensitive. We will review the concept of SMART indicators, or indicators that are specific, measurable, attributable, relevant, and timely. I will also ask you to consider what resources you have, and I will ask you to think about what you will need to get started. Finally, I will ask you to identify who the end-line users of your data are. The importance of including local targeted beneficiaries or stakeholders, especially women and girls, in the design of your intervention and plans to test or measure your intervention cannot be understated. At the very base of the work you do, strategies will only be effective and meaningful if local stakeholders are engaged and consulted in the process. As you begin planning for baseline data collection, it is important that you familiarize yourself with 2 key documents that outline Canada's commitment and focus for sustainable development. At the base of your work, it is important that your intervention and the indicators you develop to measure the effectiveness of the intervention reflect Canada's Feminist International Assistance Policy, which is a commitment to eradicate poverty and build a more peaceful, more inclusive, and more prosperous world through the empowerment of women and girls, who are often the most vulnerable, as well as the Whistler Principles to Accelerate Innovation for Impact Development, which pledges to encourage innovative ideas for inclusive and sustainable development that will accelerate the pace of change to improve the lives of the poorest and most vulnerable, including by reducing inequalities and empowering women and girls. With these 2 documents in mind, consider the work you have done up till now and the work you will do in the future related to your intervention or project, including plans for baseline data collection. Have you collaborated with local stakeholders, especially women and girls, and have these stakeholders informed your plans? Are your indicators gender responsive or gender sensitive? Meaning, do your quantitative indicators provide separate measures for men and women? And do your qualitative indicators separately capture men and women's experiences, opinions, attitudes, and feelings? Ensuring that your program planning and data collection is gender sensitive is good practice and aligns with Canada's international assistance priorities. It can also enable your organization to produce data that can be used for advocacy. It can help reveal barriers to achieving success. It can hold policymakers accountable to gender equality commitments. It can raise awareness and stimulate change. SMART indicators are indicators that are specific, measurable, attributable, relevant, and timely. At this point, I would like you to look at the performance measurement framework developed for your project. In this presentation, I will give you some examples of indicators that we will evaluate to determine if they are SMART. But I would like you to apply what we discuss in this part of the presentation to your specific indicators. Ensuring that your indicators are SMART is key to designing your baseline data collection. An indicator is SMART if it is specific, meaning that it measures only what it intends to measure. If it is measurable, meaning that it is reasonable to measure the indicator. If it is attributable, meaning that it can be clearly attributed to the intervention. If it is relevant, meaning that the indicator is likely to be achieved during the time span of the project. And if it is timely, meaning that the indicator indicates when the data will be collected. This slide gives an example of an indicator that was developed for an educational project working in rural Tanzania. The project aims to improve educational outcomes for school-aged children as well as school accountability. The indicator is availability of information on children's school performance, and the definition is the percentage of children 7 to 14 years of age who provided a school report card to parents. Is this indicator SMART? Let's examine it. The indicator is specific because it asks about the percentage of children who are 7 to 14 years of age who provided a school report card to parents. It is measurable because the program intends to survey parents and ask them if they received a report card from their child. Since the project is working to improve school accountability, it is reasonable to think that the data from the survey could be attributable to the project. The indicator is relevant because measuring the proportion of children who provided a report card to their parents is a reasonable measure for school accountability. Finally, the indicator is timely because it indicates the data will be collected at baseline and again at the end line of the study. This indicator is SMART. Here's a second example of an indicator. This indicator was developed for a health project working in Nepal. The project intends to train healthcare providers to provide care to pregnant women and newborns, including improved reporting from health facilities. The indicator is the percentage of health facilities with documentation for receiving supportive supervision from a community health management team in the previous 3 months. The data will be collected from operational data, that is data that is routinely collected by the health facility, and the data will be collected quarterly. Is this indicator SMART? A problem with this indicator is the term supportive supervision. Because supportive supervision is not defined, the indicator as it is written is not specific because we do not know what supportive supervision means. Similarly, it will be difficult to measure this indicator without a definition of supportive supervision. The indicator is, however, attributable to the project as it intends to improve reporting from health facilities. The indicator is relevant because it is reasonable to assume that the project could improve the frequency and quality of supervisory visits during the time span of the project. And the indicator is timely because the data will be collected quarterly. In order to make this indicator SMART, it would be necessary to include a definition of supportive supervision as is illustrated on the slide. Supportive supervision is defined as a supervisory visit that includes a documented discussion specific to maternal and child health. Planning for baseline data collection also involves examining what resources you have to support your data collection. Think about the people you have and if they are staff or volunteers and how much time they will be able to commit to data collection. Also consider the skill set of the people who may collect data for your project. Will it be necessary to provide your people with training for baseline data collection? Remember, the quality of your baseline data collection will depend on the quality of your tools and the availability of your team to collect data. Also think about how much time you will have and if it will be necessary to secure approvals for data collection. You may need approval from the national government or the district or state in which you are working. In many countries, it can be time-consuming to get these approvals. However, getting approvals from the appropriate authorities is essential to buy-in and sustainability of your project. Also consider your infrastructure. Do you have space to conduct trainings? Will you be able to photocopy sufficient numbers of forms? And do you have computer equipment and the expertise to create databases? Do you have a secure way to store data? How much money have you put aside for data collection? Including monitoring and evaluation in your project budget is important, as without robust monitoring and evaluation, you will not be able to evaluate if your project met its intended outcomes. Also consider what type of support you have or need for your baseline data collection. Are there other organizations or individuals in the country where you are working or in Canada that will provide you with support for your project or baseline data collection? Importantly, are local or grassroots organizations involved, especially the Voice of Women and Girls? Finally, consider who the end consumers of your data will be. Will your end consumers be government, either in the country you are working in or in Canada? Will you be targeting policymakers? Will you be looking to contribute to academic knowledge? Will you take your data back to health workers, teachers, or community members? Knowing who the end consumers of your data are may impact the data you collect and how you collect it. Thank you for taking the time to participate in this micro-learning session on baseline data collection. Please take the time to review the worksheet that accompanies this session.